Hello guys, so today we'll talk about lymphoma. So in this first we have to know what is the differential diagnosis and all. So guys, I want to show you first of all the other diseases which can cause this lymphadenopathy. So these are the diseases like toxoplasmosis, Lyme disease, tuberculosis, HIV, syphilis, hepatitis B virus, endocarditis, and histoplasmosis, crop, typhus, and these are the diseases. So we have to concern on it. So for that we have to make chest X-ray and all, and some other drugs also cause allopurinol, atenolol, captopril, and phenytoin. We have to remember this, guys, phenytoin. Okay, so these are the area where we have this lymphadenopathy. According to the area, we have to see where we can cause lymphoma. So these are the 4 areas which may especially cause lymphoma. So left supraclavicular node, in where differential diagnosis also cause like thoracic or retroperitoneal cancer, bacterial or fungal infections, cat scratch disease which may occur in the axillary regions, breast cancers, silicone implants, and brucellosis, melanoma. In epitrochlear regions, it may cause syphilis, secondary syphilis, sarcoidosis, tularemia. In angular regions, most of all STD diseases like herpes simplex virus, gonococcal infections, syphilis, chancroid, and granuloma inguinala, lymphogranuloma venereum, and pelvic malignancy and bulbonic plaque. These are the diseases we have to concern about it before we have to diagnose our diseases. So we will do blood culture, serology, clinical criteria. Okay, so to differentiate other diseases like Anna test and PDP, PPD test for tuberculosis, and the chest X-rays and all. So guys, so first of all we will do CBC, and if it is still negative, we will do PPD or fair chest radiograph in Anna, and SBSC in HIV test also we will do. And if it is non-risk malignancy, we will observe the patient for 3 to 4 weeks. After that again we will do biopsy. We will not do suddenly biopsy. If it is malignancy, risk of malignancy in serious cases, we will do biopsy in that cases. Okay, so now we will go to the so briefly about the drugs and all. So guys, these are the drugs, so we will talk about. See here, and Dakarvazine is the drug choice for Hodgkin's lymphoma. And see, this is mild lymphoma, which occurs in the gastric mucosa cells, mucosa associated lymphoid, and for that we have to give treatment which is same as H. pylori eradication we are doing, and we can give radiation and chemotherapy we can do. This week I want to tell something about the region of lymph node. I didn't show properly, I don't know why. PET scans, this is the PET scan, so we are sleeping inside. Before that we are taking drugs like glucose, radioactive glucose, so it can show full body. See the guys, this is patient of stage 4, so you can see the cervical node and axillary node and liver, and also below the diaphragm. See, this is guys all eye appearance which red Sternberg cells. You can see red Sternberg cells as all eye appearance. See, this is the red Sternberg cells which is seen in Hodgkin's lymphoma. And in Hodgkin's lymphoma, this is the better prognosis, this is the worse prognosis, and this is like in medial one. So see this one is the prognosis levels, and this is the Hodgkin's lymphoma classification: nodular sclerosis, mixed cellular lymphocytes, and this is the itching symptoms in lymphoma. So we will be confused with fungal infection is there or what, or something like that. We have to check by palpation about the lymph nodes enlargement. Some are not that much enlarged, so we have to palpate it because painless lymph node is a characteristic of lymphoma. That is painless one. If it is pain is there, it may be characteristic of infection or something like that. So we have to differentiate it by palpation and all. Red Sternberg cells, this is all eye appearance. And I want to tell here is see, this is guys diffuse large B cell lymphoma, which is see, this is guys CLL, which is B cell. I want to tell this one again afterwards. See, this is B cell. We have CD20, which is more important. And if you give rituximab, it will make apoptosis of the tumor cells to binding to the CD20 to inactivate it and make it. And this is a diffuse B cell lymphoma, which is the typical aggressive of non-Hodgkin's lymphoma, diffuse one. And this is a follicular one, which is not aggressive one, but it is a little poor prognosis, they know. See, diffuse large B cells 31, it is the incidence, and follicular 122, malignant zone B cell multi lymphoma is 8, and laser is see, this is stage 1, which is one side only one. Stage 2, two nodes will be there above the diaphragm, and this is both above and below stage 3. And if it is occur in extra node manifestation is stage 4. See here, CD20 is occur in the later stage, so we have to see in the later one, we have to check it in the later. See, this is Burkitt's lymphoma appearance, starry sky appearance, and see, this one is rituximab, which is the best drug for non-Hodgkin's lymphoma. For if it is CD20 involved, so this is the most important drug. See, this is the CHOP regimen: cyclophosphamide, doxorubicin, vincristine, and prednisone. These are the CHOP regimen for non-Hodgkin's lymphoma. This is doxorubicin's appearance. See this one, guys. So we have to give like in medication injections and all to the patients of non-Hodgkin's lymphoma. Doxorubicin is doing what? It unwinds DNA for transcription. Inhibit the progression of topoisomerase, and and also deactivate the ROS systems also, which is for cancer tumor cells. And vincristine is like this one, and adriamycin, bleomycin, vinblastine, dacarbazine. This is the medications for Hodgkin's lymphoma, ABVD, remember guys. And mechanism of actions here, you can see vinca alkaloids, which is a dissolution of the mitotic spindles chromosomes. So it is helpful in destroying the tumor DNA cells. And this is also bleomycin, also is like that only. Destroying breaks the free radical formation and inhibition of the DNA transcription and all. So adriamycin, this is the classical appearance of adriamycin medicines, guys. And vinblastine sulfate, this is the vinblastine sulfate. Adriamycin, vinblastine sulfate, this is the medication for Hodgkin's lymphoma, guys. Dacarbazine, this is also for Hodgkin's lymphoma. We are giving for Hodgkin's lymphoma mostly ABVD. remember guys. That's all guys I want to show you, and if you um, want to see something more deeply, you can pause the video and watch it for more 10 seconds or something like that, so you can get it so easily. Thanks for watching, and subscribe my channel and share it with your friends, and that's all guys. Thank you.